You might be asked to give a medication either before a case starts to help prepare the sterile field or during a case to one of the physicians in IR. So we're just going to review the steps for you to be able to do that.
So if you're asked to give help to give a medication, the first thing you're going to do is verify the expiration date on the original medication container.
It expires in April of 2022.
Then the nurse will ensure that the label for the medication has been labeled correctly according to the following: the name of the medication,
1% lidocaine,
Yes.
the concentration of the medication,
200 milligrams and 20 mLs.
Yes.
and the volume of the medication.
And there's 20 mLs in this vial.
Okay.
You'll then go ahead and hold the vial at the level so that the provider can access the medication and draw it into their syringe. Once you've completed that, you can save the vial just in case you need it for later for different purposes.
The nurse is also going to be responsible for documenting the medication that was administered to the patient. When the nurse is documenting the medication, it's a little bit different than some of our other documentation. You'll not be barcode scanning your medications in IR because we don't barcode scan as part of the process for intraoperative medications. So you will need to override this in the MAR when prompted to barcode scan. This will eventually change. Once you've overridden that, then you will document the actual medication given. That will be told to you by the provider or the people in the case. You will document how much of the medication was administered, and you'll say administered by the physician who administered the medication. You should also document that you verified the medication with that physician. For medications that require a dual sign-off, for example, Spinraza, you will need someone to sign off that medication with you in the MAR. So you'll need the physician who administered that medication, and likely that will have to happen after the case since they will be sterile when they're administering the medication.